Hey ladies and gentlemen, Brother JJ here, and it's time for me to talk about the demise of my mother, the death of my mother, and I'm going to prove to you that the MDs killed her, that prescription drugs did her in early, okay? And she was 74, she's gone. We buried her last Friday, as a week ago today, as a matter of fact. It was the funeral. And so I took a week, and then, because this news has got to get out. It has got to go viral to save people from the MDs and prescription drugs, because it is so wicked and so evil what they're doing to people, especially the elderly. Okay, right here is we got the side effects of all the drugs that my mother was prescribed. Now I want you to understand, she was deceived like so many. She believed the MDs had her best interest at heart when either they were evil or ignorant, and there's only two things I believe that you can say about an MD. They're either evil or they're ignorant. And right here you see Boniva. She was on this a couple of years ago. Okay, all these. What are the possible side effects of Boniva? I'll bring it up. Okay. Chest pain. Difficulty or pain when swallowing. Pain or burning under the ribs or in the back. New or worsening heartburn. Severe joint, bone, or muscle pain. New or unusual pain in your thigh or hip or jaw. Pain, numbness, or swelling. And here they go. Less serious side effects may include back pain, headache, redness or swelling of your eyes, diarrhea, flu symptoms, redness or swelling where the medicine was injected, nausea or upset stomach, or pain in your legs. Okay, that's one. She was on that. Crestor. Crestor side effects are usually rare, which is a lie. Lie. Signs of liver damage, such as yellow eyes or skin, upper right abdominal pain, dark urine, and elevated liver enzymes. Muscle pain, tenderness or weakness, especially if also have a fever or feel ill, which may be signs of serious breakdown of muscle, known as whatever. Yeah, the drug makes your muscles break down, but it's rare. Yeah, right. She was shriveled up and died. Okay, do you understand me? She shriveled up and died. Significant unexplained changes in the amount of urine you may produce. Kidney problems, signs of pancreatitis, such as severe upper abdominal pain accompanied by nausea and vomiting. And she sure suffered from this. Memory loss. Signs of an allergic reaction such as rash, itching, hives, wheezing, or difficulty breathing, swelling of the mouth, tongue, or throat. She suffered from all of these. Like I said, her skin got nasty, just flaky. She shriveled up like a dry, dead leaf and died. Okay? So there's those lovely side effects. Fosamax. She was on Fosamax. Of course it goes, these are supposed bones, you know. What is this? It doesn't move. Hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Chest pain, difficulty or pain when swallowing. They're all the same. Look at these.
That's why I said.
Pain or burning under the ribs or in the back, severe heartburn, burning pain in your upper stomach or coughing up blood, new or worsening heartburn, fever, body aches, flu symptoms, severe joint, bone, or muscle pain, new or unusual pain in your thigh or your hip, jaw pain, numbness, or swelling. And then any side effects are horrible. They say less serious. Okay, less serious. Mild heartburn, diarrhea, gas, nausea, vomiting, stomach pain. It's just disgusting. You can read it for yourself. I'm getting just disgusted because she was suffering from all of these. All of these. All of these, ladies and gentlemen. And it just got worse until her death. Okay? Lipitor. She was on Lipitor. Thousands of people were evaluated in these studies. They're a bunch of liars. Big Pharma are nothing but deceit, lies, and money-grubbing scum. That's all they are. They don't care about the elderly. They don't care about nothing but getting their money. Okay? So that's why it took a week to do this video. Just reading these gets me more angry and more angry and more angry. And I had a big problem with my blood pressure a couple of days ago because, I mean, you can't do anything about this because I didn't want to get a felony, if you understand what I'm talking about. So I had to just grit my teeth and just get, I mean, watching my mom die before my face is one of the hardest things. Even all the death and destruction I saw in the Navy was one of the hardest things I've ever had to go through. Headache up to 16%. Who cares? I don't believe any of these numbers. I don't believe any of them. They're liars. Remember, it's all a lie. This is what, right here, accidental injury, right there. The last thing she did is she got out of the car and fell down and banged her head on the concrete. Accidental injury. They say only 4.2 until you've been on it a couple years. Then I bet you it goes up to 50, 70% because the liars. And you can see, I don't even want to read it. You can just read these yourself. But this is one of the last ones. And it says 2 to 4% of people. You know, do you want to take that? Have any of these problems? So Lipitor's a piece of crap drug that you should get off of. Shouldn't even. Why risk it? Why risk any of this? Okay, now these last two, lorazepam and moxicam. This is what they gave her after she had almost total dementia. After they put her. They did surgery. She only lasted, we begged her, remember my other video, we begged her not to have the surgery. But this is what they gave her after the surgery. After they put a tube in her, and Dr. Wallach said, because I met Dr. Wallach, and he said it just amazes him how they abuse the elderly. That's what Dr. Wallach told me. It always amazes him how they continually abuse the elderly in our country. Understand it and mark it down. And the elderly are brainwashed like I have never seen before. I've talked to 2 or 3 dozen elderly people in the past 2 or 3 months. They're getting their knees replaced, their massive diabetes, massive rheumatoid arthritis, osteoporosis. All of them are brainwashed by the MDs. All of them think the MDs are God. And they're all being destroyed and used as ATM machines with this garbage. These are the 2 right here, the 2 bottles. Okay? And it really it's just, that's why it took a week before I did this video. Let's see this one right here. Let's see what they did. What are the possible side effects? See, they don't even put a number on these. Look at that. Confusion, depressed mood, thoughts of suicide or hurting yourself, hyperactivity, agitation, or hostility. Mom got a little hostile, didn't she? Mm-hmm. Near the end. Hallucinate. She would just sit around and smile. I mean, she looked happy as can, but she's hallucinating. Oh, it was just... She almost fainted. She almost fall over half the time. I mean, they say less serious side effects may, drowsiness, dizziness, or tiredness is not less serious. Blurred vision is very bad. Sleep problems are bad. Weak muscles are bad. Lack of balance or coordination's bad. Amnesia, forget. I mean, they're giving her drugs. She's already got dementia from these other drugs, from the statins. Some of those were statins, the other ones. You can look them up yourself. And then they're still giving her drugs that amnesia, forgetfulness. Maybe they're trying to make her forget that she's got dementia. What the hell are these people? What is their freaking problem? Nausea, vomiting, constipation, appetite changes, skin rash, and she had horrible skin at the end. Horrible. So thanks to the stupid MDs, here we go again, ladies and gentlemen. So hope your family isn't on this. See what amoxicillin does. Chest pain, weakness, shortness of breath, slurred speech. Right there, ladies. So they gave her drugs to continue on with slurred speech, with dementia, with... the more you read these, it's just horrible. Don't take prescription drugs. Get off of them. What? Swelling or rapid weight gain? Well, she had rapid weight loss. Skin rash, bruising, severe tingling, numbness, pain, muscle weakness. Yep. Severe skin reaction, fever, sore throat, swelling in the face or tongue. Skin pain followed by red or purple. You know, look at these side effects, ladies and gentlemen. This is what she had. She had it all. Massive skin problems. She was dizzy all the time, nervous, and she, like she said, she fell in the parking lot at their house and banged her head, and that was the end of her. After the 2 months after the surgery, she just got weaker and weaker and weaker and weaker and weaker. And we sat there. I couldn't even go over to the house to watch her die. And she came over with my dad, and it broke my heart. Why don't you come over and visit me? And I just had to break my heart. I just couldn't tell her I can't stand watching you shrivel up and die. I just can't stand it. And so that, ladies and gentlemen, are the wicked, filthy, horrific side effects of prescription. These are the ones my mom was on. 1, 2, 3, 4, 5, 6. And so we're just, I got another article here, I'll show you. This is from, right here, this is from researchers from the Phoenix Veterans Affairs Healthcare System recently stated in a damning new report that statin drugs designed to protect against heart disease by lowering cholesterol are killers and accelerate cardiovascular problems. The database lists 300, ladies and gentlemen, adverse effects. I want to really bring your attention here. They said my mother, right here, my mother died. That's what they said. That's what the scum MD said. That she died from Lou Gehrig's disease. Every week in my practice, I see patients with serious side effects to statins, and many did not need to be treated with statins in the first place. See? You see? This is a VA doctor. Dr. Roberts, Barbara H. Roberts, and she's even an MD. There are a few good ones, I guess. But she said these side effects range from debilitating muscle and joint pain, transient global amnesia, neuropathy, congenitive dysfunction, fatigue, muscle weakness. Every one of these my mom was suffering from. Most of these symptoms subside or improve when they are taken off the statins. There is even growing evidence of a statin leak to Lou Gehrig's disease. Okay? So the MDs, the prescription drugs, killed my mother. The prescription drugs and the MDs shortened my mother's life, like they're doing to your mother. Okay? So, one last thing I want to bring to your attention is this is what, after they gave her surgery, what they put mother on. This garbage. This crap. Right there. 26 essential vitamins and minerals. Oh, really? Well, we get 90. And Dr. Wallach and Dr. Glidden, who I trust more than any other doctors on the face of the planet Earth, they're so short of minerals and vitamins that it's disgusting. And you see that right there, artificial flavor? Well, let's go take a look. These are like 20, these are horrible. Let me read this to you. It's so small that they make it small so you can't read it very well. Where's your magnifying glass? All right, let me read this to you, ladies and gentlemen. To see the garbage they give the elderly to say, oh, this is going to be good for you, okay? Ingredients: water, sugar. Is sugar good for an elderly person? I don't think so. Corn syrup, there's more sugar, okay? More death. Vegetable oil. Corn and cocoa processed with alkali. Sodic acid, vitamin A. So those three elements right there, they say zinc and vitamin A and thiamine and all that, and vitamin B12, so they throw all that stuff in, but they only give them like 25%. They need to get hammered with it. They need to get up to 1,000% of some of this stuff, and they're only getting 30 to 25% of it. But the others, sugar, corn syrup, and oil, vegetable oil. That is not what elderly people need. Okay? That, I'll repeat, that is not what elderly people need. They don't need more sugar. They don't need oils. They don't need that. Dr. Wallach, the good food, bad food list is the best way to live, best way to eat, and do away with all oils and sugars. Okay? And so they thought that was going to save my mother after they put the tube in her. Well, 2 months and she's dead. Okay? Well, anyways, that's my side effects. The MDs and the side effects of drugs killed mother. And I have to put this out to warn other people that the side effects of drugs, of prescription drugs, killed my mother. Now, I'm going to show you a better way. Ultra Body Toddy. Now look at this. The difference between the Boost and the
dirty dishes in there.
No, Ultra Body Toddy. Look at this. Thiamine, we get 1,667%. Riboflavin, 1,470. Vitamin A, 200%. Vitamin C, 1,667. Look at this, ladies and gentlemen. This is what my mom needed. And they wouldn't let me give it to her. They wouldn't even buy it. This is all natural. It's all plant-derived. And it's Dr. Wallach's wisdom that makes the difference. All his deep research and study makes all the difference. take some OsteoFX, the bone builder. See, promotes healthy bones and joints, and it sure does. It does. It works. And this is so much gentler and so much easier than taking those horrible, horrible prescription drugs. Absolutely horrible. And then for the funeral and for the death, and this worked, de-stress, I take those. This completes the 90, EFAs, right here. That completes my 90, right here. And then I started taking daily because I ordered these because of my blood pressure. I got, it just, all the pressure. I had my truck broke down too. And it's just a lot of pressure for some reason. This comes upon all of us. And that's an easier, better way. Thank you for listening.